Hello and welcome to the Victory Education Lounge. Today, we're tackling a question that can make or break your medical residency interview. How do you deal with failure? This isn't just about recounting a time when things didn't go as planned. It's about showcasing your resilience, self-awareness, and ability to learn from mistakes. It's about proving that you can handle the pressures and challenges that come with a medical career. So if you're gearing up for your residency interviews, you're in the right place. And if you're keen on more content like this, don't forget to hit the subscribe and like buttons, and drop us a comment. We greatly appreciate your support. Now, without further ado, let's get started. First, let's dissect the question. When an interviewer poses the question, how do you deal with failure? It's not a simple probe into your ability to bounce back. It's a multifaceted inquiry designed to evaluate your self-awareness, your capacity to learn from your mistakes, and your readiness to handle the pressures and challenges that are inherent in the medical profession. Now, you might be wondering why these traits are so important. Well, in the demanding world of medicine, setbacks are inevitable. The way you respond to these setbacks can significantly impact not only your career, but also the lives of the patients you care for. Hence, your ability to handle failure effectively is a key indicator of your potential as a future medical professional. But there's more to it than that. This question also seeks to uncover whether you possess a growth mindset. This is the belief that your abilities and intelligence can be developed through dedication, hard work, and the love of learning. It's about seeing challenges as opportunities for growth, rather than insurmountable obstacles. Moreover, your response gives interviewers a glimpse into how you approach problem solving. It shows whether you're the type to sweep mistakes under the rug or confront them head-on, learning and growing in the process. It's about demonstrating that you can take accountability for your actions, reflect on the situation, and make the necessary changes for improvement. Remember, interviewers aren't looking for perfection. They understand that everyone makes mistakes. What they're really interested in is your ability to acknowledge these mistakes, learn from them, and use these experiences to become a better medical professional. So, when tackling this question, don't shy away from discussing a real failure. Instead, embrace it as an opportunity to showcase your growth and resilience. Show them that you can rise above the challenges and emerge stronger and more equipped to handle the rigors of the medical field. They want to see if you have a growth mindset and how it contributes to your professional development. Interviewers are looking for candidates who can demonstrate emotional maturity, insight into their own weaknesses, and a proactive approach to overcoming obstacles. Now, you may be wondering, why these specific traits? Well, let's break it down. Firstly, emotional maturity is crucial in the medical field. It's the ability to handle high-stress situations, manage your emotions, and maintain professionalism, even when things don't go as planned. This trait tells interviewers that you're capable of navigating the often turbulent waters of the medical world without losing your cool. Next, insight into your own weaknesses is another key quality that interviewers look for. Nobody's perfect, and in the medical field, recognizing your shortcomings is the first step towards improvement. Interviewers want to see that you're self-aware and willing to work on areas where you may be lacking. This shows your commitment to personal and professional growth. Lastly, a proactive approach to overcoming obstacles is vital. In medicine, problems arise regularly and solutions are not always clear-cut. Interviewers appreciate candidates who don't just wait for solutions to fall into their laps. They want individuals who take the initiative to tackle challenges head-on, identify potential solutions, and actively work towards resolving issues. Now, aside from these qualities, interviewers also highly value honesty and reflection. When discussing your failures, it's important to be truthful. Don't try to shift the blame or make excuses. Instead, own up to your mistakes and focus on what you learned from the experience. This shows your integrity, a quality that is highly respected in any profession, especially in medicine. Furthermore, the ability to apply lessons learned from failures to future scenarios is highly sought after. This shows that you're not just making mistakes, but you're learning from them, which is a sign of growth and development. In essence, interviewers are looking for more than just your medical knowledge or clinical skills. They're interested in your character, your mindset, and how you handle adversity. Now, let's move to the first way to answer this question. The reflective approach involves reflecting on a specific failure. With this strategy, you'll want to select a significant setback or challenge that you've faced, ideally one that had a profound impact on your personal or professional life. This isn't about picking the most dramatic or catastrophic failure, but rather one that led to genuine growth and learning. Start by succinctly describing the situation. What was the failure or the challenge? Why was it significant? Remember to keep it concise. The interviewer doesn't need a minute-by-minute recounting of events, but a clear understanding of the context. Next, dive into the heart of the matter, your reaction. How did you feel when you faced this failure? Were you frustrated, disappointed, or perhaps even overwhelmed? It's okay to show vulnerability here. It makes you relatable and human, which is exactly what the interviewer wants to see. However, it's crucial to balance this with professionalism. You're not sharing your life story with a friend, but illustrating a point to a potential employer. Then, it's time to discuss the steps you took to overcome the failure. This is where you demonstrate your problem-solving skills, tenacity, and resilience. Did you seek advice, put in extra hours, or maybe even take a step back to reassess your approach? The key here is showing that you didn't let failure defeat you. Instead, you used it as a springboard to bounce back. Lastly, and perhaps most importantly, discuss what you learned from the experience. This is the crux of the reflective approach. It's not just about the failure itself, but about the growth that came from it. Did the experience give you a new perspective or make you more resilient? Did it teach you a valuable lesson about yourself, your work, or your approach to challenges? Remember, the focus should be on growth and learning. With the reflective approach, you're showing the interviewer that you have the ability to turn failures into opportunities for self-improvement, a trait that's not just valuable, but essential in the demanding world of medicine. The second strategy is the team-oriented approach. Picture this, you're part of a medical team, each of you playing a vital role in patient care. But sometimes, despite the collective knowledge and experience, things don't go as planned. Failures happen, and they can be a valuable learning experience. That's where the team-oriented approach comes into play. In this approach, you're not just sharing a personal failure, but an instance where the team you were part of didn't achieve the desired outcome. It's about a shared setback, a collective stumble. But remember, the focus is not on the failure itself, but on your actions and reactions within that team dynamic. Start by describing the situation, the context, and your role within the team. Were you a leader, a supporter, a mediator? What was the team's goal and why wasn't it met? Be concise, but provide enough detail to paint a clear picture of the circumstances. Next, shift the spotlight to your response. How did you react when the failure became apparent? Did you step up, contribute ideas, or perhaps mediate between differing viewpoints? This is your chance to demonstrate your ability to remain calm under pressure, to think critically, and to act decisively. Now let's talk about resolution. How did the team, with your involvement, navigate through the failure? Did you help devise a new strategy, or perhaps propose an innovative solution? Highlight your role in turning the tide and how you contributed to the team's comeback. Finally, reflect on the lessons learned. How did this experience shape your understanding of teamwork and collaboration in a medical setting? Did it alter your perspective on failure, or perhaps reinforce the importance of clear communication and mutual support within a team? This approach shows your commitment to teamwork and collaboration. It highlights your ability to work effectively within a team, to navigate through setbacks, and to learn from shared experiences. Remember, in the medical field, teamwork is not just about working together, but growing together, learning together, and yes, sometimes failing together. Thirdly, we have the patient-centric approach. Now this strategy is a little different. We're not just focusing on how you, as an individual or as a part of a team, experienced and overcame failure. Instead, we're considering an instance where your failure had a direct impact on patient care. In the medical field, the patient is always at the center of everything we do. So naturally, it's crucial to demonstrate how you handle failures that affect patients. This approach is all about showing your commitment to patient welfare above everything else. So, how do you use this approach? Start by selecting an instance where a failure or mistake impacted patient care. It could be a misdiagnosis, a procedural error, or even a communication breakdown that led to a less than ideal outcome for the patient. Then, explain the situation in a straightforward and honest way. Remember, it's not about placing blame or making excuses. It's about acknowledging the mistake and taking responsibility for it. Next, discuss your role in the situation and the immediate steps you took to rectify the error. This could include any corrective actions you implemented, apologies made, or changes in procedure that occurred as a result. But don't stop there. Go one step further. Talk about how this experience influenced your approach to patient care going forward. Perhaps it instilled a greater sense of caution in you, or led you to advocate for more rigorous checks and balances in your practice. What's important here is to show that you took the mistake as a learning opportunity. Highlight how it made you a better healthcare professional who is more equipped to ensure patient safety and provide high-quality care. Remember, everyone makes mistakes, but not everyone learns from them. It's those that do, those that use their failures to better themselves and their practices, who truly excel in the medical field. This approach shows your commitment to patient welfare. The fourth strategy is the continuous improvement approach. This strategy is all about demonstrating how a certain failure sparked a journey towards continuous personal and professional enhancement. It's about showing your dedication to learning and evolving not just from your successes, but importantly from your failures too. In this approach, you need to present a specific failure and discuss how it triggered a process of constant improvement in your medical career. Start by describing the situation and your role in it. Be honest about the mistakes made and the initial impact of the failure. Remember, it's not about painting a perfect picture but about showing your ability to acknowledge and learn from your shortcomings. Once you've set the stage, talk about the aftermath. Discuss how you dealt with the failure and how it became a catalyst for change. Maybe it made you reassess your strategies, or perhaps it pushed you to acquire new skills or knowledge. The key here is to focus on the steps you took to improve, to better yourself and your professional abilities. Next, illustrate the changes you've made and the results you've seen. Have you become more efficient, more empathetic, more patient-focused? Whatever the improvements, make sure to highlight them. Show the interviewer that you're not just saying you've improved, but that you've taken measurable steps and seen tangible growth. Finally, and most importantly, stress on the long-term implications of this failure on your career. Show that this wasn't just a one-time learning experience but a launchpad for continuous improvement. Talk about how you've incorporated this mindset into your everyday practice, constantly seeking to learn, grow, and better serve your patients. Remember, medical professionals are lifelong learners. Showcasing your commitment to continuous improvement not only illustrates your resilience, but also your dedication to excellence in your field. So, when you're asked, how do you deal with failure? Use the continuous improvement approach to emphasize your commitment to learning and growing from each experience. Lastly, we have the resilience and adaptability approach. This strategy is about showcasing your ability to bounce back from adversity and adapt to new circumstances or challenges. Think of a time when you faced a significant setback, perhaps a difficult case or a personal hurdle. Discuss how you navigated through the situation, the steps you took to recover, and how you adapted your strategies or methods as a result. Your focus here should be on demonstrating your perseverance, your resilience in the face of adversity. It's about showing that you can withstand the highs and lows of a demanding medical career, and even more, that you can learn and grow from these experiences. This is not just about survival but about thriving and becoming a better practitioner through your experiences. This answer demonstrates your resilience, a critical quality for medical professionals. In conclusion, when answering, how do you deal with failure? Be honest, reflective, and focus on growth. Today, we've explored 5 distinct strategies to tackle this question effectively. The reflective approach, the team-oriented approach, the patient-centric approach, the continuous improvement approach, and the resilience and adaptability approach. Each approach offers a unique perspective, allowing you to demonstrate your emotional maturity, self-awareness, and commitment to overcoming obstacles. Remember, the key to mastering this question lies not in the failure itself, but in your response to it, your learning, and the subsequent growth. It's about showing your human side, professional maturity, and readiness for the challenges of a medical career. Thank you for joining us at the Victory Education Lounge. To continue preparing for your medical residency interview, make sure to subscribe, give this video a like, and leave your comments below. See you in the next video.